my interview for med school, and she says, you'll get here, you'll see all the things that are in the city, and then you won't want to go home.
Well, I grew up in southeastern Oklahoma in a pretty small town, and I actually don't think I knew any doctors.
I grew up in Nebraska, a very rural part of Nebraska, in a small community. I didn't even know about psychiatrists. I don't think we had any in the town that I grew up in.
I really like my small community because everyone would say it's smaller. I stayed in the city for about 3 years after I graduated from residency. I got kind of stuck into certain aspects. I either had to choose the hospital, or I had to choose the clinic, or I had to choose the newborn nursery. I did some soul searching and talking with my husband and everything. We decided to move back home, and so we came here, and I get to work in the hospital and the newborn nursery and the clinic all in a single day, and I love it.
I didn't come from a family that could afford things like medical school, but I am Native American, and the federal government has a program called the Indian Health Service Scholarship Program, and if you apply for that and you get accepted, they will pay for your med school 100%. Of course, those years were hard, but it was totally worth it. For medical school, I was able to get into UT Southwestern Medical School in Dallas, and I did my medical school and my residency in psychiatry there. But then I got back home as soon as possible. I moved back to Oklahoma as soon as I graduated, and I worked for the Chickasaw Nation for 4 years and ran an outpatient clinic for them in Ardmore and Tishomingo.
So I observed with a pediatrician and an internist, and also did some observing at a substance abuse facility, and thought, I think I like this, and I think it's a neat way to help people and make it a career. So pursued medicine that way, and then ended up in psychiatry later on. Once a person starts thinking, hey, I might want to go into the medical field, then my advice would be get some experience. See what it's about first if you have not had any experience. So there are scholarships, loans, all these things that you can get through medical school. Then you have to be smart after that too, to make sure that you can get them paid off. Try to keep that to a minimum. So anything you can do to help yourself with part-time jobs in the summer and working and saving, it's still a good thing to save.
We need to have more people that go through hardships, and we need more people to have different perspectives in medicine, because if you're privileged all of your life, then you don't understand what families are going through. You don't understand, oh, I don't have a ride to get to the clinic, and so the ER and calling an ambulance is our only way in to get care. And so I think it's really important to kind of have different people and different partners and things like that.
So my father, who was Native, had bipolar disorder, and he would go through these episodes when I was a kid where he wouldn't want to do anything. He'd be really depressed. He wouldn't clean the house. And then there would be other times he would have just like a lot of energy, and he'd decide to remodel the house and do other things that were honestly scary and reckless. And as a child, I didn't understand that. But when I went to medical school and did my rotations in psychiatry, I'm like, oh, that's what was going on. And man, wish I had known that then. We could have got him the help he needed. Because tragically, my father did die by suicide, and I wish someone could have helped him. And I think part of that was because, there's just not that type of health care available at the time where we lived. And that brings a lot of meaning to what I do.
I love people's stories. That's probably one of the reasons I went into psychiatry. Is I love talking to patients, hearing about what got them to this point, what their struggles have been, what their successes have been, and trying to understand them and help them. And then I realized that if you can affect someone's mental health, you affect their entire general health as well.
I love the small town. I now get to treat my friends that I grew up in high school with. I treat their kids and their families as they start their families. And then also I get to treat new people and new aspects of our community. And then also I just really love doing it all. I don't have to choose what I want to go into. I get to treat all kids, no matter what location they're in, and I get to use all aspects of my education. I don't feel like any of it was lost or wasted, or not forgetting anything, because anything could walk in your office at any time. So I really, really like that.
Well, my day is a little bit different. I mean, every day is different because I'm in academic medicine. So what you don't realize either, probably going into medicine, is that there's all kinds of different opportunities. So not only are there all kinds of specialties, but even within those specialties, there's different settings where you can practice.
Something that's still really important to me is figuring out how to get better access to mental health care in our rural communities. Through the pandemic, we've been able to use telemedicine to expand our services, and I'm really hoping that we can continue to do that, because it is so hard to get physicians to actually move and live in rural Oklahoma, but it's not a problem to do something like telemedicine and still give patients good quality access to care. If you have a passion like I did for learning and caring for people, science, there's no reason that you can't find the support you need to do something like become a physician.